Namaste class. I JVN Dr Poonam Sharma, Department of Organ and of Medicine, Faculty of Homeopathic Science, JVWU, Jaipur. So today we are going to discuss about the classification of the disease and Honeyman's clinical classification of the disease. Honeyman broadly divided the diseases into 3 points. The first point is indisposition, second is surgical diseases, and third is dynamic diseases. Indisposition is slight alteration in the state of health manifested by one or more trivial symptoms that have been observed only for a short time. This is not a fully developed disease, hence does not require medicinal aid. A slight alteration in the diet and regimen is sufficient to control it. Indisposition should not be considered as the disease. It can be controlled by the vital force itself, which Hippocrates also termed as the vis meditrix nature. The second is surgical diseases. In aphorism 13 and 29, Honeyman made it clear that the surgical diseases do not come into the scope of homeopathy as they are not dynamic or miasmatic in origin. They have to be treated only by mechanical or surgical means. For example, the condition like fractures of the bones, accidental cases where extensive tissue damage has occurred, etc., when no dynamic cause to be treated. Instead, in such cases, the problem is purely a mechanical trauma. It is not a disease because of dynamic disturbance, but a discontinuity of the anatomical tissue due to mechanical trauma. In such cases, just by administering the dynamic medicines, we cannot control the suffering. Instead, local measures like appropriated the bones and applying proper bandage, suture, and dressings can recover the patient along with the dynamic medicines. So, such cases which are not dynamic but mechanical in origin and require mechanical aid along with the dynamic homeopathic medicines, Honeyman called as the pure surgical diseases. The third is dynamic diseases. Dynamic diseases can be divided into two types. First is acute diseases and second is chronic diseases. So now we are going to discuss acute diseases. Acute diseases are the diseases that start with sudden onset, more or less fixed course of duration and into death or recovery with or without treatment. Acute diseases are due to acute miasm. In acute diseases, the change in the vital force is more or less superficial in comparison of chronic disease. Hence, in such diseases, vital force to some extent can set right the disturbance on its own with or without treatment. H. Roberts says, in acute manifestations, the vital functions are often restored to complete harmony by and through their own power. Kant says acute miasm is the one that comes upon the economy, passes through its regular prodromal period, longer or shorter, has its period of progress and period of decline, and in which there is a tendency to recovery. In acute diseases, we always can find some exciting cause. These exciting causes will lead to the transient explosion of latent sora. So, in short, acute diseases are sudden and violent in onset, rapid or moderately speedy course, finish their course more or less rapidly, and terminate into death or recovery. Types of acute diseases. The first is individual, the second is sporadic, and third is epidemic. Individual diseases. This is a type of disease which attacks the human individually due to some exciting cause of mental or physical origin. For example, excessive intake of food or deficient supply of it, severe chill, overheating, strain, mental emotions, etc. act as exciting cause to develop individual acute disease. Different people at different places can suffer with individual diseases at different or same times. For example, Ram may suffer from diarrhea in Chennai, Krishna may be suffering with headache in Mumbai, etc. at the same time. This acute disease is nothing but transient explosion of the latent sora. If this is not of a violent character, the sora goes into the latent stage on its own and the patient recovers, but this recovery is done at cost of same damage to the patient vitality, which makes him more susceptible to the disease. Without the medicine, the individual disease will result into death or recovery. This disease can be treated with homeopathic remedy based on acute totality. The second is sporadic disease. These are the type of acute disease that attack several persons at the same time here and there by means of meteoric, telluric, and injurious agents or influences. The exciting in this case may be either climatic influences, atmospheric or physical agent, meteoric or influences in the soil, water, telluric, etc. These causes will affect only few persons with identical susceptibility. For example, a group of people are affected with a type of fever in Chennai. At the same time, a group of suffering with headache in the same place. Sporadic disease, like any other acute disease, is because of the explosion of latent soda, and this can be treated with homeopathic medicines. Every sporadic disease must be considered as a new one at every incidence and treated based on the totality only. Third point is epidemic disease. Epidemic diseases are the type of acute disease that affect many persons with very similar suffering from the same cause. Honeyman uses the word infectious in this context because the epidemic disease become infectious when it spreads among the thickly populated area. Each and every epidemic in is a peculiar one, though seemingly they have identical origin like any other acute disease. When left to the vital force, they terminate either in death or recovery of the patient. The cause of epidemic diseases may be due to calamities of war or flood and famine, etc. Acute miasm that cause acute disease may be of two types. First is recurrent acute miasm. These miasms recur in the same manner more than once in the lifetime of a person. For example, plague of Levant, Asiatic cholera, the yellow fever of the sea coast, etc. And the second is non-recurrent acute miasm. This is also called the fixed miasm. This attacks several persons only once in lifetime. For example, smallpox, whooping cough, etc. And the second is chronic diseases from aphorism 72. The chronic diseases are diseases which have a gradual and imperceptible beginning, unlimited lifelong suffering, no tendency to recovery, and have a tendency to continue to the next generations. Unless treated with dynamized homeopathic remedies, the difference between acute and chronic disease is more than just the duration of illness. Dr. Clark also remarks that Honeyman did not use the word chronic just to denote the long standing illness, but he meant of a poison, means miasm, which had a chronic evolution right from its beginning. Kant also says chronic disease is chronic right from the beginning itself. Chronic disease can be of three types. The first is artificial chronic disease, the second is false chronic disease, and the third is true miasmatic chronic disease. First is artificial chronic disease. These are the most incurable chronic disease. These are the disease which are produced as a result of prolonged allopathic heroic medicines in large and ever increasing doses. there are These are artificial produced because of their violent and obvious action. The second is false chronic disease from aphorism 77 and refer to aphorism 7. These are also called as the pseudo-chronic or inappropriately named chronic diseases. These are diseases that patients bring upon themselves because of prolonged and continual exposure to the avoidable maintaining cause. For example, first is habit or taking liquors or any kind of dissipations. The second is prolonged abstinence of not taking the things properly, those are necessary for maintenance of life. Third is residing in unhealthy or marshy localities. Fourth is deprivation of exercise and open air. And fifth is overexertion of the body and living in constant mental and physical strain, etc. And the third point is true chronic disease. These are also called as the natural chronic diseases or miasmatic chronic diseases. The true miasmatic chronic diseases are those that arise from the chronic miasm like sora, psychosis, and syphilis. These diseases are due to the disturbance of vital force by the miasmatic forces. They continue to progress unless controlled by homeopathic employment of remedies that are specific to them by their symptomatology. The best mental and corporeal changes, the most robust, continuous the best regulated mode of living, and even the vigorous energy of the vital force cannot control or cure them. The vital force possesses the power to fight against certain acute disease, but not against chronic disease ones. These chronic miasms have tendency to remain dormant inside the organism during the youthful years. The patient may look healthy in spite of having a miasm inside. The miasm remains the latent form in such cases, but in later year when the patient comes under the influence of social or familial worries, any disturbing affections, and inappropriate medicinal treatments, the chronic disease reappear and assumes a serious character. Chronic disease are two types: the simple miasmatic and complex miasmatic. Simple or the single miasmatic disease are because of a single miasm. They are of either caused by sora or syphilis or psychosis. That means only one miasm is exhibiting its symptoms at a given time in the patient. Psychosis or syphilis cannot affect the person unless the sora is in the background. Sora remains in the dormant or latent from when the psychosis or syphilis is exhibiting its symptoms. When two or more miasms produce the sickness in one person, we term it as the complex miasmatic disease. The third possibility of the what happens when two dissimilar diseases meet condition. Thank you, class.